Ciplox eye eardrops. Ciprofloxacin eye eardrops contains ciprofloxacin hydroxide USP equivalent to ciprofloxacin 0.3%, benzalkonium chloride NF 0.01%, aqueous vehicle. Dosage form: Ciplox eye eardrops solution. Pharmacodynamic: ciprofloxacin eye eardrops is sterile ophthalmic preparation of ciprofloxacin, which is a potent broad-spectrum synthetic antibacterial agent belonging to the fluoroalkyl group. The bactericidal action of ciprofloxacin results from the inhibition of bacterial topoisomerase 2 DNA glycase and IV. These are essential enzymes for replication, transcription, and repair of bacterial DNA. Susceptibility: ciprofloxacin has been shown to be active against most strains of the following organisms, both in vitro and in clinical occur infections. Pharmacokinetics: after topical occur administration, ciprofloxacin is also absorbed systemically. Plasma level in volunteers range from non-countable to 4.7 ng/ml based on studies with ciprofloxacin solution 0.3%. Mean maximal concentrations are expected to be less than 2.5 ng/ml. Indications: ciprofloxacin ophthalmic solution is indicated for the treatment of infection caused by susceptible strains of the designated microorganism in the conditions listed below. Conjunctivitis: Haemophilus influenza, Staphylococcus aureus, Staphylococcus epidermidis, Staphylococcus pneumonia. Efficacy for the organism was studied in fewer than 10 infections. Year: otitis externa, acute otitis media, chronic superlative otitis media, prophylaxis in otitis surgeries such as mastoid surgery. Dosage and method of administration. Eye drops. The recommended dosage regimen for the treatment of bacterial conjunctivitis is 1 or 2 drops instilled into the conjunctival sac every 2 hours while awake for 2 days, and 1 or 2 drops every 4 hours while awake for the next 5 days. Year: for all infections, 2 or 3 drops every 2 or 3 hours initially, reducing the frequency of the instillation with control of infections. Use in special population. Pregnancy category C. Since there are no adequate and well-controlled studies in pregnant women, ciprofloxacin eye eardrops should be used during pregnancy only if the potential benefit justifies the potential risk to the fetus. Lactating women. Ciprofloxacin has not been measured in human milk, although it can be presumed to be extracted in human milk. Caution should be exercised when ciprofloxacin eye eardrop is administered to lactating women. Pediatric use. The safety and effectiveness of ciprofloxacin eye eardrop in infants below 1 year of age have not been established. There is no evidence that the ophthalmic administration of ciprofloxacin eye eardrops has an effect on weight bearing joints. Genetic use. No overall difference in safety and effectiveness have been observed between elderly and younger patients. Contraindication. Ciprofloxacin eye ear drop is contraindication in patients with a history of hypersensitivity to ciprofloxacin, to other quinolones, or to any of the components in this medication. Warning: for topical, ophthalmic and otic use only. In patients receiving systemically administered quinolones, including ciprofloxacin, serious and occasionally fatal hypersensitivity reactions have been reported, some following the first dose. Some reactions were accompanied by cardiovascular collapse, loss of conscientiousness, angioedema, airway obstruction, dyspnea, urticaria, and itching. If an allergy reaction to ciprofloxacin occurs, discontinue use of the drug. Serious acute hypersensitivity reaction may require immediately emergency treatment. Oxygen and airway management should be administered as clinically indicated. Precaution. General. As with other anti-infectivities, prolonged use may result in overgrowth of non-susceptible organisms, including fungi. If superinfection occurs, discontinue use and institute alternative therapy. Whenever clinical judgment dictates, the patient should be examined with the aid of magnifications such as slit lamp biomicroscopy, and where appropriate, fluorescein stains. Patients should be advised not to wear contact lens if they have signs and symptoms of bacterial conjunctivitis. Information for patients. Avoid contamination the applicator tip with material from the eye, finger, or other source. Systemically administered quinolones, including ciprofloxacin, have been associated with hypersensitivity reaction, even following a single dose. Discontinue use immediately and contact your physician at the first sign of a rash or allergic reaction. Drug interactions. Specific drug interaction studies have not been conducted with ophthalmic ciprofloxacin. However, the systemic administration of some quinolones have been shown to elevate plasma concentration of theophylline, interfere with the metabolism of caffeine, enhance the effect of the oral antioxidant warfarin and its derivatives, and has been associated with transient elevation in serum creatinine in patients receiving scopolamine concomitantly. Undesirable effect. The most frequently reported undesirable effect was local burning or discomfort in corneal ulcer studies. With frequent administration of the drug, white crystalline precipitations were seen in approximately 17% of patients. Other reactions occurring in less than 10% of patients, including lid margin crusting, hypermania, and bad taste following instillation. Additional events occurring in less than 1% of patients include coronal stretching, keropathy, allergic reaction, lid edema, tearing, prototopia, coronal infection, nausea, and discrete vision. Overdose. Tropical overdose may be flushed from the eyes with warm tap water. Incompatibility. Not applicable. Storage. Store below 25 Celsius. Protect from light. Presentation. Ciproflox. Eye ear drop. Vial of 5 ml.